am going to discuss on development of health infrastructure. After completing this module, you will be understanding the meaning of health and health infrastructure. You will get to know the healthcare undertaken in India, and you can also identify the different health programs undertaken in India by the government of India. Now the plan of discussion. First, I will start with the introductory part. In the introduction, you will get to know the meaning of health and health infrastructure. Then you will be able to understand the different objectives of development of health infrastructure, why the health infrastructure is very much important for us. In the second part, you will be learning the healthcare undertaken in India. And in this context, you will be able to understand the different challenges which the health sector is facing. Thirdly, we will discuss the health programs and the healthcare system. In this part, I will cover the different topics like public health care, private health care, mental health care, meditation, and the different initiatives to improve access to health care. And finally, I will come to the conclusive part. You all are quite aware that good health is a state of physical and mental well-being, which is very much necessary to live a meaningful and productive life. Long healthy life is the basic aspiration of human development. Health has become an important indicator of human development nowadays. It is true that a healthy person is an asset for himself and for the economy as well. To achieve good health for all, the country should promote healthcare services. The country should prevent different diseases and help people to make their healthy choices. In a society, good health for all ensures economic progress. If we all can enjoy a healthy life, then obviously the overall productivity of the economy increases, the work life of the people increases, and we enjoy fruits of economic development, fruits of economic growth and economic development. Good health promotes efficiency in the workforce, as I just told you. It enhances their skills and aptitude, and it's very much necessary for high life expectancy. Good health is absence of disease, and also it represents both physical and mental capability to enjoy life. Good health is achievable under the condition of deliverable effective healthcare services, which is possible only if we have good health infrastructures. So without good infrastructure, specifically good health infrastructure, we cannot lead a healthy life. So students, you can easily understand the importance of health and why health is related to health infrastructure. Health infrastructure is very much required, and health is impossible, good health is impossible without good health infrastructure. Now I will come to the health infrastructure, its meaning and importance. Health infrastructures are the basic services or social capital of a country or part of it which make economic and social activities possible. Structures that support public health, having both tangible and intangible aspects and existing inside and outside the government sector, can also be called as health infrastructure. Health infrastructure is an important indicator for understanding the healthcare policy and welfare mechanism in a country, and India is not an exception. Now come to the different major objectives of health infrastructure. If you consider the major objectives of health infrastructure, it can be categorized under different heads like improving access to primary healthcare services for all sections of the society, to improve maternal and child health, to ensure a reduction in the growth rate of population with a view to achieve population stabilization, to develop human resources for health to achieve health goals. Now I am coming to the second topic, that is healthcare in India. India's health infrastructure is made up of three tiers, namely primary, secondary and tertiary. And India is facing different challenges before her in the context of health sector. The different challenges are inadequate access to infrastructure, specifically health infrastructure, low budget, both from the public as well as from the private part, lack of preventive care, lack of medical research, and there is also lack in policy making in the context of health infrastructure. Also, there is shortage in professionals. Paucity of resources is another shortcoming or limitation of health infrastructure in India. And finally, the lack of medical facilities in the rural areas is also an important limitation of Indian health infrastructure. Now, what are the ways that should be taken, the steps that should be taken to improve the public health care? This can be discussed under different heads like quantum increase in budget allocation, that is more funding required for development of health infrastructure. Second is the rebuilding of trust between doctors and the patients. That is also very important. Third one is the reclaiming of peace and harmony. Fourth one is the introduction of eggs in Anganwadi centers. Fifth one is making workplaces safe, and also a stronger push against tuberculosis is also very much needed. Now come to the third point, that is health programs and healthcare system. Under National Health Mission, financial support is provided to states to strengthen the public health system, including upgradation of existing or construction of new infrastructure. Under National Health Mission, high focus states can spend up to 33% and other states up to 25% of their NRHM funds on infrastructure. And the population norms for setting up of public health facilities are as under. That is subcenters, and 1 per 5,000 population in general areas and 1 per 3,000 population in difficult or tribal and hilly areas are being allocated. For the primary health center, 1 per 30,000 population in general areas and 1 per 20,000 population in difficult or tribal and hilly areas. And for the case of community health center, 1 per 1,20,000 population in general areas and 1 per 80,000 population in difficult or tribal and hilly areas. A new norm has also been adopted for setting up a sub-health centers based on time to care within 30 minutes by walk from a habitation has been adopted for selected districts of hilly and desert areas. It has also been decided to strengthen the sub-health centers based on time to care within minutes by walk from habitations has been adopted in selected districts of hilly states and desert areas. As per the Rural Health Statistics 2020, the status of public health facilities function in the country, which can be mentioned as follows, like 1,57,921 SCS subcenters, 30,813 primary health centers, 5,649 community health centers, 1,193 subdivisional hospitals and 810 district hospitals in the country. Now come to the healthcare system. Under it, different types can be mentioned like public healthcare, private healthcare, meditation, mental healthcare, among others. First, I will come to the public healthcare. Under public healthcare, different points can be mentioned like public healthcare is free for every Indian resident. The Indian public health sector encompasses 18% of total outpatient care and 44% of total inpatient care. Middle and upper class individuals living in India tend to use public health care less than those with a lower standard of living. Since 2005, most of the healthcare capacity added has been in the private sector or in partnership with the private sector. The private sector consists of 58% of the hospitals in the country, 29% beds in hospitals and 81% of doctors. Now regarding medication. In 1970, the Indian government banned medical patents. And India signed the TRIPS agreement in 1995 which allows medical patents but establishes the compulsory licensing where any pharmaceutical company has the right to produce any patented product by paying a fee. This right was used in 2012 when NATCO was allowed to produce Nexavar, a cancer drug. In 2005, new legislation stipulated that a medicine could not be patented if it did not result in the enhancement of the known efficacy of that substance. Now regarding the mental health care, there was a major gap between outreach, finance and access in India. However, with a growing economy, the state developed an enhanced fiscal capacity to cover most citizens and residents of the country with basic health insurance cover. Next, I will discuss the different initiatives undertaken to improve access. So, in this topic, we can discuss the government-led programs. First, in the 12th plan, the Government of India tried to expand the National Rural Health Mission to the entire country, known as the National Health Mission. The community-based health insurance can assist in providing services to areas with disadvantaged populations. And additionally, the National Health Mission can help to emphasize the responsibility of the local government in making resources available. Healthcare should be made mandatory and no money should be exchanged at appointments. And finally, both private and public sectors should be involved to ensure all marginalized areas and it should be reached. Now come to the National Rural Health Mission. Different points can be mentioned like to counteract the issue of a lack of professionals in rural areas. As I have already discussed that there is shortage of professionals, especially in the rural or remote areas. So to counteract this issue, to counteract this limitation, the Government of India wants to create a cadre of rural doctors through governmental organizations. The National Rural Health Mission was launched in April 2005 by the Government of India and it has several outreach strategies for disadvantaged societies in isolated areas. The goal of the mission is to provide effective health care to rural people with a focus on 18 states with poor public health indicators and or weak infrastructure. Now, I will discuss about the National Urban Health Mission. The National Urban Health Mission is a submission of National Health Mission which was approved by the Cabinet on May 1, 2013. The National Urban Health Mission works in 779 cities and towns with population of 50,000 each. As urban health professionals are often specialized, current urban health care consists of secondary and tertiary but not primary care. Thus, the mission focuses on expanding primary health services to the urban poor As the name suggests, National Urban Health Mission, it is basically meant for the urban poor. The initiative recognizes that urban health care is lacking due to overpopulation, exclusion of populations, lack of information on health and economic ability, as well as unorganized health services. So the NUHM, National Urban Health Mission, has appointed 3 tiers that need improvement. One is the community level, that is including outreach programs. Second one is the urban health center level, that is including infrastructure and improving existing health systems. And third one is the secondary or tertiary level, that is public-private partnerships. I will come into it afterward about the public-private partnerships. We will be knowing more about it a little bit after. Now, additionally, the NUHM aims to improve sanitation and drinking water as well, improve community outreach programs to further access, reduce out-of-pocket expenses for treatment, and initiate monthly health and nutrition days to improve community health. Now come to the Pradhan Mantri Jana Arogya Yojana. It is an initiative to ensure health coverage for the poor and weaker population in India. This initiative is part of the government's view to ensure that its citizens, particularly poor and weaker group who have access to health care and good quality hospital services without facing financial difficulty. So, this yojana is mainly meant for the poor and weaker groups of the society, and they should have access to good health care without facing any financial difficulty. The next point about the Pradhan Mantri Jan Arogya Yojana is the healthcare services, which includes follow-up care, daycare surgeries, pre and post hospitalization, hospitalization expenses, expense benefits, and newborn child or children services. Now come to the public-private partnership. One initiative adopted by the governments of many states in India to improve access to healthcare entails a combination of public as well as private sectors. That is a combination or interaction of public and private sectors. So the public-private partnership initiative, PPP initiative, was created in the hopes of reaching the health-related Millennium Development Goals, which afterward came to be known as Sustainable Development Goals. In terms of prominence, nearly every new state health initiative includes policies that allow for the involvement of private entities or non-governmental organizations. Now, the major programs which has been undertaken in the context of the Indian economy. First, we should mention about the fair price shops. The fair price shops aim to reduce the costs of medicines, drugs, and other orthopedic devices, among others. Currently, there is no competition between the pharmacies and the medical service stores for the sale of drugs. Thus, the price of drugs is uncontrolled. The fair price program creates a bidding system for cheaper prices of medications between drugstores and allows the store with the greatest discount to sell the drug. The program has a minimal cost for the government as fair price shops take the place of drugstores at government hospitals, thus eliminating the need to create new infrastructure for fair price shops. The largest segment of the public-private partnership initiative is the tax-financed program, called Rashtriya Swasthya Bima Yojana, RSBY. The scheme is financed 75% by the central government and 25% by the state government. These programs aim to reduce medical out-of-pocket costs for hospital treatment and visits by reimbursing those that live below the poverty line. Finally, the National Rural Telemedicine Network connects many healthcare institutions together so doctors and physicians can provide their input into diagnosis and consultations. This reduces the non-medical cost of transportation as patients do not have to travel far to get specific doctors or specialties opinions. However, problem arises in terms of the level of care provided by different networks. Now come to the concluding part. To wrap up whatever we have studied in this module, we should mention that different programs adopted by the government of India has been discussed, like National Rural Health Mission, National Urban Health Mission, and different sub-centers, different primary centers and community services which are helping to promote or to develop health infrastructure has also been mentioned. We have also came across the different health programs and healthcare services adopted in India. We have mentioned about the public health care, private health care, medication, mental health care, and also we have mentioned the public-private partnership initiatives undertaken in India to promote or to develop health infrastructure. Now, if we consider the different studies to calculate the Global Healthcare Index, we can mention that according to the Global Healthcare Security Index 2021, India ranked 66 out of 195 countries with an overall index score of 42.8 and along with a change of minus 0.8 from 2019. So, it is easily understandable from the figure that India has developed its health infrastructure in 2021 compared to 2019. That is to achieve a score of 42.8 in 2021 from 2019 and making a change of minus 0.8, that is increasing 0.8 is a big deal. So India has achieved India has achieved a lot in 2021 compared to 2019, but it should develop its health infrastructure much more because India is becoming overpopulated and most of the diseases are also being affected by large numbers of people, and the number of diseases are also increasing day by day. Also, if we consider the health and the health systems ranking of the countries worldwide in 2021, which it shows that by health index score, India ranked 111 out of 167 countries. So, it can be concluded that India is still poor in health infrastructure and hence we are not getting adequate health care. So, much development is needed in the context of health infrastructure so that the Indians can lead a healthy life.